take Zobo in pregnancy? That was one of the questions I asked. Welcome to my pregnancy and postpartum journey. I asked myself, can I take Zobo? Well, in my first trimester, I didn't take Zobo, but I later on took Zobo around my second or third trimester, but I stopped. Here is it. Zobo is actually very juicy, very nutritional. It is also called hibiscus drink or hibiscus tea. Zobo has lots of benefits. One of them is that it provides you with vitamin C, but there are also risk factors associated with taking Zobo or hibiscus tea during pregnancy. Number one, potential uterine stimulation. It stimulates the uterus where the baby is lying, or where the fetus or the embryo is lying. So, in the first trimester, you want to avoid anything that would kick your baby out of your womb. When we talk about potential uterine stimulation, it sends blood into the uterus, which can lead to miscarriage. So when you're in your first trimester, it's actually very important to watch all of those. 2, blood pressure. Taking Zobo has been proven to cause hypotension, leading to lower blood pressure. So when you go for antenatal, your blood pressure is always checked. When your blood pressure drops, your gynecologist, your midwife, or your nurse will ask you, what have you been taking? So you want to avoid having low blood pressure, especially if you're someone that has had an history of low blood pressure in the past. Number 3, hygiene. If for any reason you'd love to take Zobo, make sure you are making it at home on your own. It is not commercially made. It is not made outside. So you can be sure what constituents it needs, what amount of whatever they put in the Zobo, and you are sure you are taking the right thing. And number 4, interference with medication. Hibiscus leaves or hibiscus tea can interfere with certain medication. So be sure that when you are taking Zobo, you are not taking it with your medication. You're not taking it with your prenatal drug. You are taking it alone during the day when you're not even taking your drug at that moment at all. So though you would like to take Zobo, it is advised that you take it minimally, in moderation. If you have a green light by your doctor, your gynecologist, or your midwife that you can go ahead to take Zobo, it is fine. But ensure that moderation is put in place. Moderation is key. Now, talking about risk-benefit ratio. The risk in some women is actually higher than the benefit. So if I would advise, in your first trimester, do not take Zobo. And if possible, throughout your pregnancy period, do not take Zobo depending on what your body mechanism is. For me, I took Zobo, but at some point I stopped because I noticed that I started having some reactions I couldn't explain. So it's advised that if the risk outweighs the benefits, just do away with Zobo, at least for the period of pregnancy. It won't hurt a fly, will it? If you found this video helpful, please do share it.